Medical revalidation of Puerto Rico, salicylate poisoning. Clinical question. An 80-year-old man is found unconscious by his son and is brought to the emergency department. Initial laboratory results reveal anion gap metabolic acidosis and respiratory alkalosis. Which of the following is the most likely diagnosis? A. Methanol poisoning. B. Ethylene glycol poisoning. C. Salicylate poisoning. D. Diabetic ketoacidosis. Correct answer, C. Salicylate poisoning. Explanation. Aspirin salicylate poisoning presents with a mixed acid-base disturbance. 1. Early phase, respiratory alkalosis due to direct stimulation of the respiratory center, leading to hyperventilation and low PaCO2. 2. Late phase, anion gap metabolic acidosis due to the accumulation of salicylic acid and lactic acid. A key finding in salicylate toxicity is the coexistence of respiratory alkalosis and metabolic acidosis, which differentiates it from other toxic ingestions. Why not the other options? A. Methanol poisoning, incorrect, causes anion gap metabolic acidosis, but it is associated with ocular toxicity, optic neuritis, blindness. No respiratory alkalosis is typically present. B. Ethylene glycol poisoning, incorrect, leads to anion gap metabolic acidosis, but it presents with renal failure and calcium oxalate crystals in urine. No significant respiratory alkalosis. D. Diabetic ketoacidosis, DKA, incorrect, causes anion gap metabolic acidosis, but patients typically have polyuria, polydipsia, fruity breath odor, and hyperglycemia. No respiratory alkalosis is expected. Key takeaways for the medical revalidation of Puerto Rico exam. Salicylate poisoning presents with mixed respiratory alkalosis, metabolic acidosis. Key symptoms: hyperventilation, tinnitus, nausea, vomiting, altered mental status. Diagnosis: arterial blood gas, ABG, showing low PCO2 plus low HCO3 plus anion gap metabolic acidosis. Treatment: alkalinization of urine with IV sodium bicarbonate, activated charcoal if early, and hemodialysis in severe cases. This is a high-yield toxicology question for the medical revalidation of Puerto Rico exam.